So I will speak about classification of cerebral circulation disorders, hypersensitive cerebral crisis. So the cerebrovascular disease includes a variety of medical conditions that affect the blood vessels of the brain and the cerebral circulation. The arteries supplies oxygen nutrients to the brain are often damaged or deformed in this disorder. The most common presentation of cerebral vascular disease is an ischemic stroke in mini stroke and sometimes hemorrhagic stroke. And the hypertension is high blood pressure is the most important contributing risk factor for stroke and cerebrovascular disease. It can change the structure of blood vessel and the result in atherosclerosis. Narrow cerebral arteries can lead to ischemic stroke, but continually elevated blood pressure can also cause tearing vessels leading to hemorrhagic stroke. Mm. So as we see here, the first picture it's the thrombotic stroke, and the second one embolic stroke, and cerebral hemorrhage. So the signs and symptoms. The most common presentation of cerebrovascular disease is an acute stroke, which occurs when blood supply to the brain is compromised. Symptoms of stroke are usually rapid in onset and may include weakness of one side of face or body and numbness on one side of the factor or body, inability to produce or understand speech, vision changes, and balance difficulties. Hemorrhagic strokes can present with a very severe sudden headache associated with vomiting, neck stiffness, and decreased consciousness. Uh, Symptoms vary depending on the location and the size of area of involvement of the stroke. Edema or swelling of the brain may occur, which increase intracranial pressure and may result in brain irritation. A stroke may result in coma or death if it involves key areas of the brain. And the causes, we have three types: congenital, congenital disease are medical conditions that are present at a birth that may be associated with or inherited through genes. The acquired cerebrovascular disease are those that are obtained throughout person's life that may be prevented by controlling risk factors. The idiopathy are those that occur spontaneously without a known cause. Next. Like, uh, diagnosis of cerebrovascular disease may include the medical history, physical exams, neurological examination, acute stroke, and scientific symptoms of new ones. The epidemiology worldwide, it is estimated there are 31 million stroke survivors. Thought about 6 million deaths were due to cerebrovascular disease. And it primarily occurs with advanced age. The risk for developing it goes up significantly after 65 years of age. Next. The hypertensive crisis represented more than one-fourth of all medical urogenic emergencies, also frequently present with headache and faintness and psychomotor agitation, and hypertensive emergencies frequently present with chest pain, dyspnea, and neurological defect. The types of end organ damage associated with hypertensive emergencies include cerebral infarction, acute pulmonary edema, and as well as a cerebral hemorrhage. Next, the treatment. Examples of medications like antiplatelets, ruxolitinib, blood thinners, heparin, antihypertensives, ACE inhibitors, beta blockers. And thank you.
Noor, please return the slide showing the dislocation of the brain. Please return this slide.
The dislocation of the brain.
Please return slide. I want to some comments. Stop. Yeah, picture with dislocation. Next. Oh, stop. This picture, this slide shows the cause of death of all stroke patients. These patients are necessary terminal coma with respiratory disorders. You can see the dislocate the brain and dislocate the cerebellum in the foramen magnum. Compressed the breath center, and the patient is dying. Please, next presentation. Thanks.
Okay, today we're going to speak about the classification of cerebrovascular hypertension and embolism of the cerebral vessels, etiology and pathogenesis, clinical picture, and the treatment. Type of strokes. The strokes can be classified into two major categories: ischemic stroke and 87%, and Haemorrhagic stroke, it's 30%. The ischemic stroke, it's occurring when the blood supply to an area of the brain tissue is receded in the tissue hypoperfusion. There are several potential mechanisms which can result in the initial stroke, including embolism, thrombolysis, and systemic hypoperfusion, and cerebral venous thrombosis. The hemorrhagic stroke. Hemorrhagic stroke occurs secondary to ruptures of the blood vessel or abnormal vascular structure within the brain. There are two subtypes of hypoplastic stroke known as intracerebral hemorrhage and the supracondylar hypocerebral. The first one is involving bleeding within the brain secondary to the ruptured blood vessel, intracerebral, and can enter intraparenchymal within the brain tissue, and or enter within the ventricle. The second one, supracondylar hemorrhagic. So it's type of stroke caused by bleeding outside of the brain tissue between the brain matter and aconial matter. Blood supply of the cerebrum. The anterior, medial, and posterior cerebral anterior is simply a specific territory of the brain. The anterior cerebral anteromedial area of the cerebrum. The medial cerebral artery is separated in the majority of the lateral cerebrum. The posterior cerebral artery separated as mixture of the medial and the lateral area of the posterior cerebrum. And this is the medial and lateral view. Banformate classification of inclinating stroke. The most commonly used classification system of the inclinating stroke is Banformate classification system. This system categorizes stroke based on the initial presence syndrome and the clinical things. This system does not recommend imaging to the classification of stroke and straight in the base of the clinical findings alone. The total anterior correction stroke, TACC, is a large control stroke affecting the area of the brain separated by both the medial and anterior cerebral artery. All three of the following need to be pressed for diagnosis of the GISAs. The parietal anterior circulation stroke is a less serious form of the GACC, which only parts of the brain of the anterior circulation has been compromised. Two of the following need to be pressed for diagnosis of PACC. And the posterior correction syndrome involves damage to the area of the brain simply by the posterior circulation, cerebellum and brainstem. One of the following need to be pressed for for a diagnosis of POSAC. The Lancashire stroke. That is a subcortical stroke that occurs secondary to the small vessel disease. There is no loss or high cerebral function. One of the following need to be present for a diagnosis of a recent stroke, premature stroke, sensory motor stroke, and accessic brain. Thank you.